Nasogastric NG tube, description and uses. A nasogastric NG tube is a flexible tube inserted through the nose, down the esophagus, and into the stomach. It is used for medical purposes such as feeding, medication administration, or removing stomach contents. Types of NG tubes. 1. Levin tube, a single lumen tube used for short-term feeding or decompression. 2. Salem sump tube, a double lumen tube used for suctioning and decompression, with an air vent to prevent stomach lining damage. Uses of an NG tube. Feeding, provides nutrition to patients who cannot eat normally. Medication administration, delivers medicines directly into the stomach. Decompression, removes gas, fluids, or toxins from the stomach, for example, in bowel obstruction. Diagnostic testing, collects stomach contents for analysis. Insertion procedure. 1. Preparation, the patient is positioned upright, and the appropriate tube size is selected. 2. Measurement, the tube length is measured from the nose to the ear, then down to the stomach. 3. Lubrication and insertion, the tube is lubricated and gently inserted through the nostril. 4. Confirmation, placement is confirmed by checking pH, auscultation, or an X-ray. Risks and complications, nasal irritation or bleeding, misplacement into the lungs, risk of aspiration, pneumonia, gastrointestinal discomfort or injury. An NG tube is generally a temporary solution, with long-term feeding requiring a gastrostomy tube. G tube. Would you like more details on its management or specific uses? Management and care of an NG tube. Proper care of a nasogastric NG tube is essential to ensure patient safety, prevent complications, and maintain its function. Below are key aspects of NG tube management. 1. Confirming proper placement. Before each use, check placement to avoid misplacement into the lungs. pH test. Aspirate stomach contents and check pH should be as less than or equal to 5.5 for gastric contents. Auscultation Whoosh test. Inject air and listen for gurgling in the stomach, not always reliable. X-ray, the most accurate method, usually done after initial placement. 2. Securing the tube. Tape the tube to the patient's nose or cheek to prevent movement. Ensure the tube is not kinked or pulled. 3. Feeding through an NG tube. Use liquid formulas recommended by a healthcare provider. Administer feed slowly using gravity or a pump. Keep the patient upright 30 during and after feeding to prevent aspiration. Flush the tube with warm water before and after feeding to prevent clogging. 4. Medication administration. Crush medications if allowed and dissolve in water before administering. Flush with water before and after each medication to prevent blockages. Do not mix multiple medications together. 5. Suctioning and decompression. For patients needing stomach decompression, for example, bowel obstruction, post-surgery, connect to low intermittent suction to prevent stomach damage. Monitor drainage color, consistency, and amount. Replace electrolytes if excessive fluid loss occurs. 6. Preventing complications, blockage. Flush the tube regularly with warm water. Nasal irritation. Rotate the tube and apply lubricant to the nostril. Aspiration pneumonia. Always check placement before use and keep the patient upright. Mucosal injury or ulcers. Monitor for discomfort and/or. 7. Removing an NG tube. Ensure the patient is ready, for example, able to swallow or no longer needs decompression. Flush the tube with air or water to clear it. Ask the patient to take a deep breath and hold it while gently pulling out the tube. Provide oral care afterward. When is an NG tube used long-term? If a patient requires tube feeding for more than 4 to 6 weeks, a gastrostomy G tube or jejunostomy J tube may be recommended instead.